Check out this integral lymphatic system. This is the lymphatic system in a nutshell. But you're thinking, whoa, is it really green? Well, it's not really green, but it's nice to see, right? I mean, look at the intricate details of it, and we're going to talk about what it actually does and what it actually means. Okay. All right, so what's the components and function of the lymphatic system? Well, the components are lymph, which is fluid. You have lymphatic vessels, you have lymphatic tissue, and then you have lymphatic organs. Okay? And what's the function of the lymphatic system? You always want to know what the function, what system does what. Well, the lymphatic system, it basically recovers fluid that's lost from the blood capillaries. Okay, so remember, between arteries and veins, you have capillaries, and you're going to lose some fluid. And that's going to guard against pathogens, so that's immunity. And it also absorbs lipids, which is fats, from the small intestine. You have those structures called lacteals inside the small intestine. And when we do the GI system, we'll talk about those. So here's some fun facts. Lymphatic system works in coordination and collaboration with the lymphoid system, the immune system, and the cardiovascular system. So all these things, all these themes that you see, that no one system works by itself. It just works as a team. Okay? Because of its circulatory role in the body, it is also considered as an essential part of the circulatory system, where the former cannot be separated from the latter and vice versa. They need each other, symbiotic. The interstitial fluid that flows through the network of lymphatic capillaries, vessels, ducts, and nodes may be termed as tissue fluid, lymphatic fluid, or simply lymph. So those are all interchangeable. The right lymphatic duct measures only about 1.25 centimeters in length, while the thoracic duct may measure as long as 45 centimeters, and it receives about 75% of the body's lymph. The most important parts of the accessory circulatory system are lymph nodes, capillaries, ducts, and vessels, where the first one is the fluid, and all others contribute to the formation of the network of interconnected tubes or channels. So let's dive into what it really is. Now, what's lymph? So basically, that's clear, colorless fluid. It's similar to blood plasma, very low in proteins. Tissue fluid taken up by the lymphatic vessels, supplies lymphocytes to the bloodstream. You remember what lymphocytes do. And lymph intestine is called chyle. You have lymphatic vessels. Lymphatic capillaries, which are terminal lymphatics, have loosely connected overlapping endothelial cells. And I'll show you a nice little picture of these. Overlaps act as flaps to ensure only one-way flow of tissue fluid into the lymphatic capillary. Large gaps between cells allow for large substances such as proteins and whole cells to enter the lymphatic capillary. And large lymphatics are similar to veins in structure, but with thinner walls and closer valves. So here's a good direction and something that you want to know: the flow of lymphatic capillaries. Then it goes to these collecting vessels. Then these collecting vessels go to the lymphatic trunks, and then it goes to collecting ducts. And guess what? It goes to the subclavian vein. So these lymphatic trunks are named by location. So you have a jugular, subclavian, bronchomediastinal, intercostal, intestinal, and lumbar. You have two main collecting ducts, and these you want to know. The right lymphatic duct, convergence of trunks in right thoracic cavity. So it drains the right upper limb, the right side of the head, and the right side of the thorax. That's the right lymphatic. All the rest drains into the thoracic duct, begins at the cisterna chyli of the abdomen. So you get about 25% that dumps into the right lymphatic duct, but then you get the rest that dumps into the thoracic duct. So here it is. So basically, here's the network, right? So it takes up all this excess fluid. You have these inguinal lymph nodes here, okay? You have abdominal lymph nodes. You have axillary lymph nodes, okay? You have palatine. You have cervical lymph nodes, okay? So, and here's the big one. Here's the thoracic duct, and it dumps into the cisterna chyli right here, okay? It's coming up. There's a spleen. That's part of the lymphatic system. All right, it's quite surprising to note that the spleen is the accessory organ of the lymphatic system that plays an important role in its disease-fighting abilities. With the help of this system, your body not only gets rid of extra fluid, produced therein, but also fights against various fatal diseases by killing the germs and harmful substances. Two major types of white blood cells. White blood cells are also called lymphocytes, namely T lymphocytes and B lymphocytes, which are also termed as T cells and B cells, respectively. When your body cells get infested with viruses and some other fatal microbes, the T cells come into action and destroy them. In case of pathogenic bacteria, B cells are assigned a job to deal with them. Okay, so viruses and fatal microbes, you get T cells. If you have bacteria, it's B cells. Remember, bacteria B, viruses and microbes are T cells. Any damage to the bone marrow might result in serious decline in the immunity level of your body. This is simply because the bone marrow is the place where white blood cells are generated and are transported to the lymph nodes for their action against disease-causing agents. So if you look at this, here's the lymphatic capillaries. So here's the arteriole, here's the venule. Remember, they join together in this capillary bed, but you're going to have fluid that's going to leak out of here. And guess what? All the fluid that leaks out, your lymphatic system picks up. And they have a one-way valve. So if you look at this, see these little openings here? See these little openings here? Well, guess what? This excess fluid is picked up by the lymphatic system. It's a neat little system. Can you imagine that? Now, if something goes wrong with the lymphatic system, this is where you get edema. Okay, and we'll talk about the difference between inflammation and swelling. People use those words interchangeably, but it's not the same. Ranging from 500 to 700 number, the lymph nodes are the small organs which compose the lymphatic system. In certain organs of your body, such as the groin, neck, and underarms, the lymph nodes are found in a large number. So that's why you can get soreness, or they check for tenderness in your groin, neck, and underarms. The flow of lymph is aided by rhythmic contraction of the lymphatic vessels, rhythmic contraction of your heartbeat, and rhythmic contraction of muscles. So really, there's the only true way of getting rid of this excess fluid or swelling is by being active. So that's why you'll see patients that are overweight, that you see a collection of fluid in their legs. That's because they just sit around all day and eat bonbons and watch Judge Judy. They need to get up. All right. Flow of lymph resembles venous blood flow. So you have low pressure and low speed. Remember, veins are low pressure, low speed. Valves facilitate only one-way flow toward the heart, and the skeletal muscle pump activates respiratory pump. So when you breathe, you move lymph. When you move lymph, and the pulse pressure of neighboring arteries. So the high pressure of the arteries also moves the lymph. So lymphatic cells, you have neutrophils, you have natural killer cells, attack and kill cells. You have T lymphocytes, which are T cells, thymus dependent. You have cytotoxic T cells, helper T cells, regulatory T cells, memory T cells. You have B lymphocytes, which are B cells, plasma cells that secrete antibodies, and then you have memory B cells. And I'm going to show you a nice little video about the difference between T cells, B cells, and natural killer cells. All right, some more fun facts. There are a number of mild, slowly progressing, serious, and even fatal diseases which attack the lymphatic system and disturb its structure and function. Lymphocyte or lymphoid leukemia involves the diagnostic symptoms of night sweats, fever, weight loss, fatigue, and enlargement of lymph nodes. Hodgkin's lymphoma is an abnormal and uncontrolled cancerous growth of the lymph nodes due to the proliferation of the same type of cells, which may even spread to other parts, such as the lungs, liver, and bone marrow. Castleman's disease of the lymphatic system may be either unicentric or multicentric, that is, it affects either one lymph node or may systematically spread to other nodes. The accurate and timely diagnosis followed by an effective treatment may measure lead to the early and timely cure of various lymphatic system diseases. In some cases, lymphatic diseases may even go ignored or unnoticed even for many, many years because it's slow moving. Now, lymphatic cells, you also have macrophages, which develop from monocytes, display antigens to the T cells. So it says, hey, you're marked, and you're going to, the T cells are going to take over. Dendritic cells, branched macrophage found in epidermis, mucous membranes, and lymphatic organs. You have reticular cells, stationary cells, stroma of lymphatic organs. Now, this you know, again, I don't like to pick on those granolas, but they like to spread bad information. So for a while, they were saying that underwire bras would cause cancer. And research says although the idea of having one's breast in cages with metal wires, impeding fluid, and marinating breast tissue in toxic liquid, this was their marketing ploy. Sounds like a reasonable explanation for cancer, but it's not. In fact, as it points out, far from being trapped, bodily fluid actually travels up and out of the armpits, not down toward the underwire. So they didn't even know their anatomy. So they're making up stuff and causing all this uproar about underwire bras, and it had no anatomical reason. So keep wearing them. You're fine if that's what you wear. All right, so here's the valves in the lymphatic system. Looks like a little P, right? But here's the valve, right? It's a one-way valve. Goes shh, 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 shh. So the valves close just like in veins to prevent bad backflow. Doom, doom, doom. Okay. The fluid exchange between the cardiovascular and lymphatic system. So here's the cardiovascular system, and here's the lymphatic system. Look how closely tied together they are. And again, they're intertwined between the capillary bed, and it basically takes the excess fluid, that's all it does, excess fluid, all the way back into the circulatory system. Okay, so there's little fluid that's going to leak out of there, and it's the lymph's job to pick up that extra fluid. If it didn't do that, I'll show you the disorder that occurs when you have issues with the lymphatic system. It's called lymphedema. All right, so this is a good, this portion, remember the right side of your head, the right arm, and the right thoracic is drained by the right lymphatic duct, but look at this. The rest of the body is drained by the thoracic duct. And then here's the lymphatics in breasts. Okay, remember when we're dealing with breast cancer, we want early detection. We don't want it to spread into the lymphatic system. Once it spreads, it goes into the circulatory system, and then it can spread throughout the entire body. Well, here's damage to the lymphatic system right there. And this was after breast surgery, where unfortunately the right lymphatic duct was compromised. They had to, and now you don't get the excess fluid to be taken out because, well, you had a choice, right? Breast surgery after breast cancer. Now you have damage to the right lymphatic. So remember, the right lymphatic duct drains the right arm, the face, and the chest. Well, if you have damage due to breast cancer, guess what? This is what happens. Now, this is very difficult to treat because you're going to have to do all sorts of lymphatic drainage, wrapping. Unfortunately, this is a very difficult case. Lymphatic tissues, lymphoid tissue made up of collections of lymphocytes in connective tissue and mucous membranes. You have these MALT, and they're called mucosa-associated lymphatic tissue in passages of your respiratory, digestive, reproductive, and urinary tracts. Can be loosely distributed as diffuse lymphatic tissue or densely packed as lymphatic nodules, such as aggregated lymphoid nodules, Peyer's patches. So these Peyer's patches of the small intestine, they're found in there. So as you know, the large intestine has a lot of bacteria. So you throughout the small intestine, you'll have this Peyer's patches. So none of that bacteria can get into the small intestine. So there's an immune response there. Again, the overview of the lymphatic organs. Primary lymphatic organs, places where lymphocytes become immunocompetent. Red bone marrow. B cells learn to recognize antigens. Thymus, T cells learn to recognize antigens. The secondary lymphatic organs, lymphocytes already immunocompetent, means they know that they're competent in the immune system. You have lymph nodes, tonsils, and the spleen. So these are the parts of the lymphatic system. Interesting to know that unlike the blood circulatory system, your lymphatic system does not possess any pumping organ for the movement of lymph through its network of channels. Okay, so the smooth movement of fluids in the system is assisted by pressure created by muscle movement and the heartbeat. So the more you move, the less swelling you're going to have in your joints. It's plain and simple. The first ever reference of the lymph circulation can be found in the research work of Hippocrates. It goes back to the father of medicine, Hippocrates. Did you ever experience the swelling of lymph nodes? Yes. Such a condition occurs when disease-causing agents, such as germs, are trapped at these checkposts, and the white blood cells are busy in fighting against them. So remember I told you, if a patient comes in and they have tenderness under their armpit, tenderness under their mandible, then you're like, okay, you have an infection. But if a patient comes in with a big old nodule and it doesn't hurt and it's not tender, but you have a big nodule, I'm very concerned because that can be cancerous. They're found in the abdominal cavity just behind the stomach. Spleen is one of the secondary lymphoid organs. Did you know that spleen can even be removed from the body without jeopardizing your life because this large lymph node-like structure just acts as a blood filter? And one of the things that it houses is monocytes. So it's a large reservoir for monocytes in the spleen. The red bone marrow, site of hematopoiesis, supplies lymphocytes and other blood cells. Okay. Reticular cells secrete colony stimulating factors for leukocyte production. All right. The thymus, bilobe, meaning two lobes, organ between the sternum and the aortic arch, houses developing lymphocytes and secretes hormones. But guess what? It shrinks after the age of 15. So by the time you're adult, the thymus doesn't really do much. It has several lobules, each with a cortex and a medulla. The cortical and medullary epithelial cells seal off blood vessels and secrete chemical messenger promoting development of T cells. Presence of thymus in newborn is necessary for development of immunity. So that's why a child has a huge thymus, so it's got to develop its immune system. So here's the thymos, the right lobe, left lobe. Okay. Here's some more damage to the lymphatic system. Yeah, you're going to see patients like this. And usually they have comorbidities, diabetes. They're usually extremely overweight, and they don't take care of themselves. The diet is poor. So that's damage to the lymphatic system. Okay. Lymph nodes, you have a whole bunch, numerous bean-shaped structures less than 3 centimeters long, function to cleanse lymph and act as site of T and B cell activation. They have an outer cortex with germinal centers and inner medulla. Several afferent vessels lead to node, but few efferent vessels leave its hilum. Concentrated in certain regions, such as, again, we mentioned cervical, axillary, thoracic, abdominal, intestinal, mesenteric, inguinal, and the popliteal areas. So here's the anatomy of a lymph node. Looks like a little bean-shaped. Okay, so here you have these afferent lymphatic vessels that come in, bringing the lymph in from all different directions. Okay, and then it leaves via, it's got an artery and vein, and then you have an efferent lymphatic vessel. So this is where it gets filtered, right in here. So it's bringing it from all different areas. This is a lymph node, and this can get swollen, and because it's got a whole bunch, maybe an infection, and it's saying, okay, we got to filter this out, and that's what it's doing. Those that have had their tonsils removed, patches of lymphatic tissue at the entrance of the pharynx right here. So you have the palatine tonsil, you have the pharyngeal tonsil, and then you have a lingual tonsil. Okay, most people have had their palatine tonsils, not most, but a lot of people have those removed. There's 3 sets, a single pharyngeal tonsil, adenoids, 2 palatine tonsils, and numerous lingual tonsils. The spleen, it's the largest lymphatic organ. Red pulp, concentration of erythrocytes right here. And then you have white pulp, which is lymphocytes and macrophages. Okay, so red pulp, that's where the red blood cells are, and the white pulp is where the lymphocytes are. Immunity. We talk about a lot of immunity. So there's modes of defense. You have innate immunity, which is barriers to invasion by skin and mucous membranes. General actions, inflammation, fear against pathogens that penetrate. And adaptive immunity, which is ability to defeat and remember specific pathogens based on their antigens. And there's 2 types, humoral and cellular. I'm going to go a little bit more in depth on this right now here. All right, just to reiterate, humoral immunity performed by B lymphocytes and antibodies. The antibodies are secreted by plasma cells and circulate freely in body fluids. Then you have cellular immunity, which is performed by the cytotoxic T cells. After developing in the thymus, they are distributed widely, especially to lymph nodes. T cells attack enemy cells with lethal hit of toxic chemicals. So again, here is the red bone marrow. Okay. Here's the thymus, and then here's the lymphatic tissues. So you have tonsils, lymph nodes, and the spleen. And then here's the thymus. Okay, so B cells are made in red bone marrow. T cells are in the thymus. Okay. So you have cellular immunity, and then you have humoral immunity. Embryonic development, oh, look at even a little baby. You get these lymphatic systems and nodes developing very early. Fight that infection early on. The aging, unfortunately, the quantity of red marrow, lymphatic tissue, and thyroid hormones definitely decline with age. When you have fewer helper T cells, slower responses to antigens, and of course, you have increased incidence of cancer. So the older you get, you have T cells that go down, and then your chance of cancer going higher. Poor discrimination of antigens results in increase in autoimmune diseases. So what happens is your body doesn't recognize good antigens and bad antigens, and basically then it attacks everything, and then your body starts attacking itself. So you get autoimmune diseases, unfortunately. Autoimmune diseases, immune attack of its own tissues, insulin-dependent diabetes, rheumatoid arthritis, those are all autoimmune. Allergies or exaggerated immune responses. Immunodeficient diseases, failure of immune responses. So allergies are autoimmune, meaning diabetes autoimmune, rheumatoid arthritis autoimmune, and there's a plethora of other autoimmune diseases that we've talked about throughout the semester. Again, just to kind of reiterate, lymph nodes, cleanse lymph, site for lymphocyte activation. The spleen, that cleanses blood, removes aged or defective red blood cells. Stores platelets, but like I told you, monocytes, and then iron. So a big storage reservoir for monocytes and platelets, and of course iron. MALT, mucosate lymphoid tissue, prevents pathogens from penetrating mucous membrane, site for lymphocyte activation and proliferation, and the thymus is site of T cell maturation. And here's lymphedema. Talked about that. Lymphedema is a chronic swelling caused by buildup of fluid that occurs when the lymphatic system is either faulty or damaged, usually after some kind of surgery or breast cancer. An estimated 3 to 5 million Americans suffer from lymphedema, including many that are undiagnosed or untreated. Most physicians in the United States are taught about the lymphatic system for about 1 hour, so they don't really know what the lymphatic system does or how to treat it. There's no known cure, unfortunately, for lymphedema, but it can be effectively treated with compression therapy, and that's what I'm showing you here, compression therapy. Without patients are increased risk of other complications. Medicare and many private insurance companies do not cover compression garments, wraps, or bandages, so that's unfortunate. And then the Lymphatic Treatment Act is a bill currently in Congress that aims to improve insurance coverage for compression. So you can always, if you have a patient like that, refer them to a lymphedema clinic and they can help them out there. But again, what are some causes of this? Lymph node removal, usually that's the #1 cause after cancer treatment. You can get an injury to lymphatic vessels, venous insufficiency, and then sometimes it's just congenital. You're born with it. Alrighty.